this is Dr. Adam Kopsky from Advanced Rehab and Medical here in Jackson, Tennessee, and I'm coming on here to tell you about our topic this week, and it discusses carpal tunnel. So for those of you who don't know, we do the whiteboard topic each week, and so when you come in, you'll see in the rehab section and even at the front desk a stack of papers that has the weekly topic and handouts. So be sure to come in and grab one of those. And so like I said, this week is about carpal tunnel. And so first off, what is carpal tunnel and carpal tunnel syndrome? So what it is when you get irritation down here in the wrist, especially on the flexor side. A lot of times when we get overuse injuries and we're doing too much stress and we're typing a lot or using our hands, maybe we're doing assembly factory work and gripping so hard, we can over time, it doesn't happen in one day, but over the period of doing that repetitive motion over and over, can start irritating the muscles and ligaments right here in the wrist. And when that happens, there's a tunnel where the nerves go through to go down to our hand, and if that gets irritated with so much stress, then all of a sudden we get numbness, tingling, or paresthesia, which is a fancy word for irritation in the skin, and we get all kinds of discomfort. So a lot of times though, what people don't realize is that that nerve right there in your wrist, okay, actually comes all the way up our arm and originates in the neck. So even if you're getting irritation down in the wrist, we commonly with a chiropractor always check the neck to see where along this path is it coming. Is it just getting irritated here or up at the neck? And so one thing I wanted to talk to you about was one very effective exercise you can do at home that can really help your carpal tunnel syndrome, which is what we call flossing. So just like when you brush your teeth and you do flossing for your teeth, you can actually floss the nerve, okay? And so this is very important, just like anything in our body, muscles, everything, and joints need motion, okay? So nerves are the same way. So if we can mobilize these nerves, we can actually desensitize them and decrease the sensation of them, which in result will decrease our symptoms that we're having, maybe numbness, tingling, or even coldness in the hands. So what you want to do here, okay, is bring on the affected hand, whether it's left or right. I'm going to demonstrate the right one. We'll rest our hand just like this, so we actually have a relaxed arm and elbow, and then you want to take your head away from your arm just like this. Now I'm going to step forward here and demonstrate this very slowly. So then what you want to do is laterally bend your head to the same side as the affected arm and hand, and as I do that, I'm going to extend my arm out and then flare my fingers all the way back. And what I'm doing here is, and you look down towards your hands. Now you want to go just until you feel a pull, and then you want to come back just like this. So now we're loose here and tightening the cord up here. So in full speed it'll look similar like this, and we come back and forth, really flossing that nerve and then coming back. If you can do about 3 sets of 10 of those, that's very effective exercise to help desensitize that nerve and help you feel better. So one thing I want to stress here is that this should not be painful. So just go until you get that pain and then come back. We don't want to exacerbate it if you go too far. Okay, so once again, thank you very much for listening to me, and I hope you guys come in and feel free to ask questions as always if you have carpal tunnel syndrome and want more information about us. All right, thank you.